The over-the-door exercise pulley is designed to help restore range of motion and stimulate muscle strength and blood circulation. It's ideal for shoulder or arm rehabilitation. The exercise pulley should only be used once you've been cleared by your physician or physical therapist to perform exercises at home. A metal bracket exercise pulley is better than one with a fabric strap because it can be installed with one hand. A fabric strap version needs two hands, which can be a challenge when recovering from surgery. Additionally, you will want an exercise pulley that can be adjusted to be used in either a seated position or a standing position. How to install. The initial installation will take only a few minutes. Simply follow the directions to attach the handles to the guide rope, then feed the rope through the pulley system, and finally attach the pulley to the door. How to exercise. Consult your physician or therapist for the exercise that is right for you. Standing shoulder flexion exercise. Position yourself so that your back is facing the door. Grab the handles and stretch both arms straight out in front of you. Your arms should be at shoulder height. You may need to adjust the handles and rope to accomplish this. Take your good arm and pull down slowly so that the arm or shoulder that you are rehabbing is pulled up. Stop the motion just at the point where the arm or shoulder starts to feel uncomfortable or there is pressure in the joint. At this point, reverse the downward motion of the good arm. Allow the arms to move to a level position. Repeat this motion about 10 to 12 times based on your physician's recommendation. With each repeated motion, try to get a little more stretch without causing excessive pain. Sitting shoulder flexion exercise. This time you will need to be seated in a chair. Grab the handles and hold both hands so they are at ear height. Elbows should be positioned next to your torso and your palms facing each other. Slowly pull down with your good arm so that the rehabbing arm or shoulder is being pulled upward. Stop the motion just at the point where it starts to feel uncomfortable. Reverse the downward motion of the good arm and allow the arms to move to a level position. Repeat this motion about 10 to 12 times. Each repeated motion, try to get a little more stretch without causing excessive discomfort. After repeated exercises, you should notice that your range of motion is improving with less discomfort.